Ever heard about an abdominal hernia? It's more common than you might think. Picture this. An organ or tissue in your body decides to take a detour, protruding through a weak spot or opening in your abdominal wall. This little detour can result in a noticeable lump or bulge, and it's not just about aesthetics. This lump can come with a side of pain or discomfort. It's like an uninvited guest that crashes your party and then refuses to leave. In the world of abdominal hernias, there's quite a variety. Some are more common in men, some in women, and others can occur regardless of gender. They can show up in different areas, from the groin to the belly button, and can even make an appearance at the site of a previous surgery. There are several types of abdominal hernias, each with unique characteristics and causes. First up on the list, we have the inguinal and femoral hernias. The inguinal hernia, the most common type, often occurs in the inguinal canal nestled in the groin. This type of hernia is more prevalent in men, and it's not shy about making its presence known. A noticeable lump or bulge is often the telltale sign, and surgery may be needed to repair it. Next, we delve into femoral hernias. They share the same neighborhood as inguinal hernias, setting up shop in the groin. However, they are more common in women. Like their inguinal counterparts, femoral hernias are not ones to hide. They too can lead to a visible bulge and may require surgical intervention. To sum it up, both inguinal and femoral hernias are abdominal conditions that occur in the groin. Their visible bulges and potential discomfort make them hard to ignore. These hernias primarily occur in the groin area and can be quite uncomfortable. Moving on, we explore umbilical and incisional hernias. Umbilical hernias occur when a part of the intestine protrudes through a weak spot in the abdominal wall near the belly button, also known as the umbilicus. More common in infants, these hernias can also occur in adults, especially those who are overweight or pregnant. Now let's talk about incisional hernias. These are a bit unique because they develop at the site of a past abdominal surgery. Here, the abdominal muscles may have weakened, or the tissue didn't heal properly, leading to a hernia. Interestingly, an incisional hernia can surface months or even years after the surgery. Both umbilical and incisional hernias can cause a noticeable lump or bulge, often paired with discomfort or pain, and while they may seem different, they share a common feature. They both highlight areas of weakness in our abdominal wall. These hernias happen near the belly button or at the site of a previous surgery, respectively. Wondering how to identify an abdominal hernia? Let's talk about symptoms and treatment. The hallmark sign of an abdominal hernia is a bulge or lump in the affected area. This protrusion can be uncomfortable, causing pain or a dragging sensation. In some instances, the bulge may vanish when you're lying down, only to reappear when you stand or exert yourself. Don't ignore these signs. Treatment for abdominal hernias typically involves surgical repair, especially if the hernia is symptomatic or there's a risk of complications. Incarceration, where the herniated tissue becomes trapped, or strangulation, where the blood supply to the herniated tissue is compromised, are serious conditions that require immediate attention. While surgery may be necessary, other options like watchful waiting or lifestyle modifications could be recommended, depending on the severity of the hernia. Remember, if you suspect an abdominal hernia, it's crucial to seek medical advice. Abdominal hernias are common but should never be taken lightly. Over the course of this video, we've delved into the intricate details of abdominal hernias, shedding light on their various types: inguinal, femoral, umbilical, and incisional. Each, with its unique characteristics and risk factors, underlines the complexity of our abdominal anatomy. We've also highlighted the telltale signs of a hernia: a noticeable lump or bulge, often accompanied by pain or discomfort. Remember, these symptoms may vary, and sometimes the bulge may disappear when lying down, only to reappear when standing or straining. Surgical repair is the most common treatment, particularly if the hernia is causing discomfort, or if complications such as incarceration or strangulation are a risk. However, the final call always rests with a healthcare professional. They can evaluate the severity of the hernia and recommend the most suitable course of action. Stay informed, and remember to consult a healthcare professional with any concerns. Your health matters.